You are listening to Thrival Nutrition Podcast, episode 65. Welcome to the Thrival Nutrition Podcast with me as your host, Lahana Vigliano. We talk all things holistic living, real food nutrition, fitness, herbs, essential oils, and so much more. I'm here to make your holistic lifestyle simple, easy, and fun for you and your family. I am beyond thrilled that you are here. So let's go over and hop over to today's episode. Happy Tuesday! It is days away of us moving, and I can't believe it. And I know if you've been listening on the podcast, maybe you've been with me since the beginning, or at least a couple weeks, you know that we are relocating to Austin, Texas in a couple days, I can say, and that's just crazy. It went by so fast. If you ever are in life and you just have something coming up and you're like, it's going to take forever. You know, I remember saying that in high school, like, oh my gosh, high school is going to take so long. It goes by so fast. It really does. And so we're getting excited. We're getting pumped. In today's episode, I'm interviewing Dr. Tassone, who is a holistic OBGYN over in Austin. How awesome is that? And you're getting kind of like a first glance. He is making a book, and it's actually all about what we're talking about today of hormonal imbalances and the Shais Method that he has. And this book, I can already tell, is going to be a must read, one that you are just going to have to buy, especially if, you know, as we go through certain hormonal issues throughout this episode. And if you feel like you resonate with yourself on one of those, like, wow, that really sounds like me, you have to make sure that you get this book when it comes out, because he's going to make this simple for you, but also effective. And so I'm just super excited to start chatting with him and share with you guys the episode that we did together. And in the meantime, if you have not found us over on Facebook in our Facebook group, go click the show notes. You can find us at www.facebook.com/groups/easy holistic living. Really, really simple. But go connect with us over there. I know that he's actually in this group, Dr. Tassone is. So if you have any questions on this podcast, please be sure to ask them in there and we can answer them for you. Okay, so here you go. Enjoy the show. Hi, Dr. Tassone. Thank you for coming on the Thrival Nutrition Podcast. How are you doing?
I'm doing good. Thanks for having me on.
Yeah. We are going to be talking about female hormonal imbalances, which you're the perfect person to talk to about. So before we get started, just introduce yourself to our listeners, letting them know who you are and what you do.
Shawn Tassone. I'm a OBGYN out in Austin, Texas. I did a couple of years of integrative medicine training at the University of Arizona College of Integrative Medicine with Andrew Weil back in about 2005 to 2007. And then after that, did a 5-year PhD program at Saybrook University, which is technically philosophy, but during my tenure, I spent most of my time in mind-body medicine therapy. So obviously, as an obstetrician gynecologist, I spend a lot of time dealing with hormonal imbalances, but I've also been using a lot of integrative therapies with my treatment plans. And in, I want to say around 2005, 2006, Suzanne Summers came out with a book called The Sexy Years. And in that book, she listed me as an expert. And so since that time, I've had quite a few patients coming from around the country where I have been dealing with hormonal imbalances, you know, with probably tens of thousands of women over the years. So I think that I've gained quite a cadre of experience, and because of this, over the last probably year, I've developed this program, because it's difficult to talk to patients sometimes about hormone imbalance. You might say to a woman, you know, hey, it looks like you might have estrogen dominance, and it doesn't really convey what that is. So what I've tried to do with my practice is try to convey the message to women about how they can understand this. And so I came up with this concept of hormonal archetypes that you can either have based on a lab tests, or you can have with a quiz that I'm developing. And then kind of talking about these imbalances, and I have 12 of them, the 12 most common imbalances in female hormones. So that's who I am and where I'm at.
Awesome. That's great. I Need to read that book. I think it was on my book list from Suzanne that you talked about. I have so many on there. I need to catch up. But before
tell me about it.
Yeah. And you're coming out with a book too, right?
Yeah, it'll probably be out later this year. I'm almost done writing it, but I have a lot of this stuff on my my Facebook page. My Facebook page is facebook.com/Tassone TASSONE DOC. And my website is www.dr Shawn Tassone, so it's DRSHAWNTASSONE.com. And I've been putting a lot of stuff on there about these hormonal imbalances just to give people kind of something to read about. And I'll be doing some Facebook Lives on these in the upcoming months.
Awesome. I'm excited. Your book will be on my list to read.
Well, thanks.
Before we get into it, tell us, if you can, and I know this is a really broad question, but is there a common factor or cause in many of the hormonal issues out here? And, why is it there's an increase in the current population that, women just are developing these?
Well, I think there's a couple of things. Probably the main thing is that we just have a poor diet, and we're also exposed to a lot of external chemicals and things like that can be neuroendocrine disruptors and can throw off your hormone balance. But the diet causes weight gain, and the weight gain can cause imbalances in what we call the hypothalamic pituitary axis, which is basically brain talking to ovaries, adrenal glands, and things feed back on the brain, and that whole communication system is kind of messed up. And the other thing is, and I think this is more evolutionary, is that we are living longer. And in the terms of evolution, it's only been a few hundred years. We've gone from probably living into our early 40s to living into our 80s. And our hormones, our ovaries, our testicles haven't quite caught up with the aspect that we're living longer. So I think that what's happening is probably in the next few hundred years, I bet things like menopause and perimenopause will probably be something that happens farther into a woman's life, like maybe into her 60s rather than in her 40s. And because we have so many baby boomers that are, hitting their 50s and 60s, I think it's just going to be something that we're just seeing more of.
Interesting. I never thought about it in that aspect, in that light. That's pretty interesting. Diving into the top 12, go ahead and you can name them. What are these top hormonal imbalances? And if they have them, how are they feeling? What are women feeling?
Well, this is kind of a down and dirty, real quick. I don't want to explode anybody's head or anything, but and they're not in any particular order, although I will say the one that we probably see the most in our culture right now is the estrogen dominance. And I call that one because estrogen is the hormone, the female hormone that we think of. And what other archetype is female other than a mother than what I call the queen? So estrogen dominance is what I call the queen. And the queen is, you can be good queen, you can be bad queen, off with their head. I think that women who are in this archetype generally have an issue where it's not so much that they lack progesterone as much as their estrogen levels are so high that they are feeling miserable for the most part. They can have irregular periods, weight gain, headaches, mood swings, breast tenderness, fibroids on their uterus, pelvic pain, ovarian cysts. There's a lot of different things that can cause this. And for a lot of women, especially those that don't do well on birth control pills, because a birth control pill can be an estrogen dominant state because the estrogen level in the pills is so high. So we see this one quite a bit, and it's very common. I would probably say 70 to 80% of the patients I see have this archetype. Wow. Playing off of that one, if your estrogen then is too low or deficient, that's kind of what we think of as menopause. And so the archetype, I was trying to think, how do I explain to women who are in, menopause is probably the most commonly understood or something that we know a lot about. Yeah. But estrogen deficiency, I call it the wise woman. And I think that, I was toying around with these years ago, and I was calling it the crone because it's kind of that older female. And I think that the crone obviously had some negative aspects to it. And I was trying to make these less negative and more kind of descriptive. So I went with the wise woman because obviously women in this stage of life, at least the majority of them, are in their older years, 40s and 50s. And they've learned a lot. There's something to learn about this state. They have a lot of knowledge. But basically, vaginal dryness is one of the symptoms. Hot flashes is probably the biggest one. Insomnia, skin is looser, more wrinkles, age spots, maybe some mild depression, decreased libido, basically what you think of when you think of menopause. The one after that would be what I call progesterone deficiency, which tends to be women who are, have issues with PMS, or their ovaries, for whatever reason, in that second half of the cycle don't have the progesterone that they need. And when I was looking at this archetype, the state in a female life where progesterone is very high is pregnancy. And pregnancy is what I would consider the hero's journey for women. And so to be deficient in progesterone, I call that archetype the unbalanced hero, because you don't have the balance of that progesterone in the phase of your cycle when you need it. So what happens is progesterone is somewhat of an anti-estrogen. So it gives you that blockade so you don't have the negative effects of the estrogen. So progesterone is a calming hormone. It's a diuretic. It stabilizes the uterine lining. So there's a lot of things that progesterone does that help. So women that have it, they'll tend to have irritability and insomnia, bloating, breast tenderness, because they have a lot of the aspects of estrogen dominance because they don't have the benefit of having that progesterone come through. Okay. So the next one would be cortisol. And cortisol is a hormone that's made in the adrenal glands, which are these two little walnut-shaped glands that sit on top of your kidneys. And we hear a lot about adrenal fatigue and adrenal insufficiency in this day and age. And adrenal glands basically help us deal with stress. And so cortisol is a stress hormone. The problem is, in our culture, we tend to be stressed about a lot of things. And unlike our ancestors who would get stressed out because they were running away from a tiger, as soon as the tiger stopped chasing them, their stress would go down. And so with their cortisol, the problem in our culture is our cortisol just stays up. I mean, that tiger never goes away for us. And so cortisol excess, which is very common, I see this very frequently in women, especially women who have very stressful jobs or very stressful, they're dealing with 4 kids in a job, or, there's a lot of that. I call those women the workaholics because even when they are calm, they are constantly working in their heads. They don't take care of themselves. They have high stress levels. They're depressed. They can't concentrate. They got that brain fog. They've got insomnia. They have a lot of anxiety. They're very driven. Basically feel like they should do stuff for everyone else at their own expense. Basically sounds like a mother on steroids for the moment. Yeah. Which it is, but they also will have a lot of fatigue, weight gain, acne, stretch marks. They can have issues with blood sugar, and basically kind of have that metabolic syndrome where you have, I call it the body shape that looks like a potato with toothpick legs, or for other women, that abdominal obesity where they have a little bit of a belly, but the rest of them looks fairly, normal. Yeah. And this is just kind of that state where you're just constantly, I tell patients that it's kind of like burning a candle, only you're using a blowtorch. You are constantly, pressuring yourself. And so the best way I could describe that is just by that kind of that workaholic. And then on the flip side, you have some women that have what would be considered a cortisol deficiency. And this is what in the functional medicine world they call adrenal fatigue. And adrenal fatigue isn't a medical diagnosis, it's more of a descriptor. But cortisol deficient patients tend to be those patients who maybe were workaholics before, and now their adrenals have gotten so bad and so not taken care of that they are kind of burning out, and so they swing the other way. And I call these women the saboteurs, and I call them saboteurs because basically they're sabotaging their own health. They've gone so far now into that cortisol problem, that stress problem, that now they're not physically taking care of their physical, emotional, psychological needs, and they're on that phase of kind of burning out. These women they're just tired for absolutely no reason. They have problems getting up in the morning even after they've had 8 hours of sleep. Difficulty bouncing back from illnesses, or if they work out, they feel that constant craving of sweets or salt all the time. And interestingly enough, they tend to feel more awake after 6 o'clock or after dinner. They kind of get that second wind. So that's the cortisol folks. Then we have another common one that I see. This is testosterone deficiency. And while we don't talk a lot about testosterone deficiency in women, it's very, very common.
Yeah.
And it's something that, I see basically in women from ages 25 to, 65. Birth control pills can cause this, but so can just hormonal imbalances. And I call this, interestingly enough and funny enough, I call it the nun. And because we think of nuns as not having much of a libido, or maybe they do and they're not very good nuns. But I grew up with nuns because I'm Catholic. So we call this hypoactive sexual desire disorder, that decreased libido thing. And testosterone deficiency isn't necessarily the only driver of decreased libido. I mean, there's relationships and stress and all that stuff as well. But women tend to have testosterone deficiencies, and my wife, who is also an OBGYN, basically feels as though testosterone deficiency in women is, the plague of the 21st century. It's something that isn't talked about very much. Oh. We talk about men all the time. There's testosterone injections. There's 10 different types of testosterone replacement for men that are FDA approved. There are 0 for women.
Wow.
Yeah, and the interesting thing is that women have testosterone. I mean, we know women have testosterone, and so why we don't think about replacing it? It's good for bones, it's good for muscles, it's good for hair, it's good for your mood. It's kind of a feel-good hormone. So women that don't have enough testosterone, obviously they feel fatigued. They can have some weight gain. They just don't feel like their workouts are as good as they used to be. They can have osteopenia or osteoporosis, some mild depression, anxiety, mood swings, and basically just a generalized decreased libido. Sometimes a difficulty having orgasm or decreased genital arousal. And I always joke with them, I can jack your testosterone up to the level of your husband's. It's not going to necessarily make you want sex more, but it might make you a little more aggressive during intercourse. But I always say indirectly, if you feel better, because these women crash in the afternoon, 3 p.m, they're wanting to go to bed,
Yeah.
But if you feel better because you have more energy and you just feel better about yourself, then you might be more interested in sex because you just feel better. So It can have an indirect response. Then there's the women on the flip side who have what I would say is testosterone excess. And this isn't very common because testosterone excess can usually come from a few things. One being you're taking too much. Another being, and I have a story in my book where I have a patient who her husband was using androgel, which is a gel that you just rub on your skin, and he would put the gel on and then he would rub it on his stomach, and then an hour or two later they would have sex and get all sweaty and all of his gel would rub off on her. And so her testosterone was like super high.
Wow.
You can also have what you might hear a lot about, polycystic ovarian syndrome, where your ovaries are just cranking out estrogen and testosterone. So women that have PCOS can also have testosterone excess. And I call these people, or these females, the hedonists. And I say hedonism.
I love your names.
I said hedonism because testosterone excess is, some of these women, like this lady I talked about, feel great because their testosterone levels are so high. They feel like, sexual, they feel their workouts are good, they feel energized. The problem is if your estrogen is too high, you can get some negative changes as well. You can have excess facial hair, acne. Your voice can change. If your voice changes, that's actually, unfortunately, a permanent thing that doesn't go back. It gets deeper. But the problem is some of these women, they feel better in the mornings. They got better workouts. Their endurance is better. And so sometimes it's hard to convince them that they need to come down, because they feel so good. And so that's why I call it hedonistic, because it's just this kind of feel good thing. But you got to watch it. And you got to, if somebody is super high, you want to help them, bring those levels back down. Looking up a little higher than the pelvis, we have the thyroid gland. And the thyroid is obviously very important because it controls our metabolism. So women that are hypothyroid, meaning their thyroid glands aren't making enough, I call them the underdogs, because they're basically they're still doing what they need to do to get through the day, but they're just not doing it with what they need to have. And so their metabolic rate is super low. They have fatigue, their stamina's poor, unexplained weight gain, muscle weakness, irregular periods, thin hair, achiness in their muscles and joints. They can have memory problems. And this is a serious one, obviously. I mean, hypothyroidism is something that you need to have fixed, and you need to see somebody that knows how to deal with that. The problem is a lot of folks, this is men too, who have weight gain, always think that they have hypothyroidism if they have weight gain. And it's usually not the case. Usually weight gain is because we're putting too much into our mouths and we're not having enough come out of our body. And so, but it can happen, and it usually happens with women that have a family history or that are postpartum, is when we see hypothyroidism a lot. And so if you have unexplained periods, or you're postpartum, you've gained a bunch of weight, or you have a family history of thyroid problems, then you definitely want to get in and get that checked. On the flip side, we have hyperthyroidism, which is where your thyroid gland is overproducing for whatever reason. You have Hashimoto's, or you have other inflammations of the thyroid gland, or you have nodules. And I call these women the overachievers. And the overachievers because they feel like they are the hamster on the treadmill. Like they are zoom, 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 because their metabolic rate is so high. A great example is a lady I had who was postpartum, who lost like all this weight. She was looking great. And then the weight kept kind of coming off, and yet now she couldn't sleep at night because she just felt like she was so revved up. She had a heart rate that was, 100, 110 at times, even when she was laying on the couch. And so her engine was just like revving while it was idling. Wow. And that's kind of what hyperthyroidism does. It's unexplained weight loss. These patients have heat intolerance, like they're always hot. They can have tremors because they're so, on edge. Their thyroid gland can be enlarged. Now, somebody like classic example of Barbara Bush had what's called Graves' disease, the older Barbara Bush. And that's where you get the bulging kind of eyeballs, brittle hair, and muscle loss. So it's also obviously something you need to get checked out. Another one, which is a combination of what I call estrogen dominance. So you have super high estrogen, and then you also have super low progesterone. I call these women, which is a combination of the queen and the unbalanced hero, is what I call the mother. And the mother is a queen who's basically run herself ragged, so she's trying to rule her country, her home, She's doing it with, no progesterone, so she doesn't have the balancing effect of the progesterone, which can help her sleep and help her get past the estrogen dominant issues. Other people kind of notice this before they do. So, they might be asking you, are you doing okay? Are you're too busy taking care of all these other people, which is what mothers do. And stepmothers also, it's not just mothers,
Yeah.
but it's a distinction between those two archetypes. So you have this hero person who's not quite balanced. They're doing all these heroic deeds. They're driving their kids everywhere. They're working all day. They're ruling their country, but it's just kind of getting out of control. And we'll talk about the Shais Method that I have to help these ladies fix things, but it's a combination issue. Then we talk about another combo, which is a combination of the queen and the workaholic, or the estrogen dominant with the cortisol excess, which is also a lot of women in these days and times. You've got the women who are just like the queens running their country, and they're also just like on super stress mode.
Yeah.
And I call these women the caregivers, because I think of women like that work in healthcare who are constantly taking care of sick people. Like, they're out there, they're working, they're caring for others. Doesn't necessarily have to be a mother archetype, but somebody who's a caregiver. You also have the feelings that nobody's taking care of you. Your needs aren't being met. They usually tend to not have somebody like a significant other, or at least somebody that's not taking care of them. So they might have a particularly needy husband or somebody that's not supportive of them. They feel run down all the time. They're overweight. They have the signs of estrogen dominance and cortisol excess. So like they have that abdominal weight gain. They have that stress factor. They're burning that blowtorch, that candle with a blowtorch. Then I have women that are estrogen deficient and testosterone deficient, which is a combination of the nun and the wise woman. And I call this one the child because children are also estrogen and testosterone deficient because they don't have ovaries that are helping them produce that yet. Mm-hmm. A good example is a patient who is very comfortable with who they are, like children are. They are learning a different phase of life. They're looking at, but they also have some irritability and insomnia, issues with body image and self-esteem. Maybe an advanced stage of menopause, meaning they're farther out than, say, 50. Maybe they're in 60, 65. They may not feel quite like themselves, but they're not totally miserable. And then they have a little bit of the issues with the estrogen deprivation, like the vaginal dryness, decreased libido. And so I call them children because not necessarily concretely children, but it's just like basically back to that archetype where you don't have the hormones that you had when you are, in midlife. Yeah. And so those are the main ones. And then, I talked to you earlier about the process that I have to help.
Yeah. Share with us what that is. The Shais Method, you said.
So again, my whole thing in the last few years of my practice has been what I consider self-care, taking care of yourself and trying to be a little bit empowered. And I'm not saying that I'm necessarily the greatest patient either, but I think if you could learn, if we could all learn a little bit of self-care, we wouldn't necessarily need to be going to the doctors for things. We wouldn't have diseases like diabetes and, hypertension and things like that. And so the Shais Method was a way that I kind of wanted patients to have options. And the Shais stands for spiritual practice, hormonal modulation, infoceuticals, or what I would say energetic, what people would consider energy medicine, or energetic aspects of illness. Nutrition, exercise, and supplementation. And in each of these archetypes, I have a specific Shais Method that you can either pick one of, you can do all six, you can, pick and choose what might work for you. And the nice thing about it is it's very individualistic, because what might work for you even in the same archetype, might not work for somebody else. And so, somebody with estrogen dominance might respond well to a diet that's higher in cruciferous vegetables, right? Because it contains diindolmethyl or I3C indole 3-carbinol, which is what's in cruciferous vegetables like broccoli and Brussels sprouts and things like that, because what that does is it lowers your estrogen level. But some people might not be able to eat enough of those vegetables because they don't like them. And so what we have is you can get supplementation. You can buy DIM, you can buy I3C at the store. I obviously think it would be better to get it from the actual vegetable because you got the fiber, which fiber can also lower estrogen levels because it can reabsorb estrogen in the gut. And so, but somebody else might respond better to a good spiritual practice, like I describe walking meditations, where you can just go out because you get a little bit of exercise, and that you also have this time to, detach, and learn more about you, and so everything kind of, is very individualistic.
I love that, and I love the creativity with it too. Is that all going to be in your book?
Yes.
Oh, that's going to be a really good book. I'm dying to read it. So give us about top 3, something that women can walk away from this episode that they could start doing today. I guess it's broad because, like you said, it's so specific, your Shais Method, to each individual woman and depending on what their hormones are. But I guess just top 3 general things that women can do.
One, I guess I would say is, and you probably would agree with this doing what you do, get rid of processed carbs. Yeah. I think, I can tell you just personally, and I'm always open to sharing my own stories. I'm not a female, but I think our bodies are fairly similar with processed carbs. There's absolutely no reason to eat them. I mean, I always tell patients just I'm simple. So that would be another thing, would be to keep it simple. And the easiest way to keep things simple, especially with, your diet, is I always just say, if you can eat it, or if you can kill it or pick it, then you can eat it, right? Mm-hmm. If it's in a bag or a package or a box, then probably don't need to be eating it. So that would probably be the easiest thing, although probably the hardest thing at the same time. Because we have such dense calories in our lives that it's hard for us to monitor that. And the other thing that goes along with that is I always tell patients to buy a food scale, because I think it's important to measure out what your serving size is. Because if you could see, I took a handful of peanuts one day and I looked at the thing. I was like, oh, this is 170 calories. And I was like, oh, I should be able to eat this. So I decided one day to measure it, and it was 3 servings. So I was eating 510 calories, and I thought I was eating 170. And so when people come in and they say, or they call you and they say, oh, I'm eating clean. And it's like, well, yeah, but how much are you eating? So that's one thing I would take away. The second thing is, and I tell everybody this, you're not broken. Let's not look at this as being something you can't fix. Unless we're talking about something like Addison's disease, where your cortisol deficiency that's a medical problem that needs to have some serious interventions, or if you have an ovarian tumor or something like that. But most of these are things that we can fix with the Shais Method or with just cleaner living, And the last thing I want to convey to women that I tell everybody is, your problems, your issues, even in these archetypes, doesn't always have to be hormonally related. When a man is in a bad mood, we don't say to him, oh, your testosterone must be off, right? You laugh because it's stupid.
Yeah.
But we do that to women all the time, right? If they have a decreased libido, it's because their testosterone is low. If they're bitchy, it's because they must be, perimenopausal. If they're depressed, it's always hormones. Well, I always tell women, what if you're in a bad mood because somebody made you mad? Or what if you're, it's funny, my wife jokes with me sometimes and says, I don't have a decreased libido. I don't want to have sex because you're being a jerk. Okay, well, she'll just tell me how it is. But but sometimes men are really good at making you feel like you got a problem, and it's got to be your hormones because I'm fine, and so my takeaway message with that is that while it may very well be a hormonal imbalance, that isn't necessarily the whole problem, and that's not what defines you as a person, is your hormones. A very important piece, but it's not what defines you. And you can, it's funny because I have 3 boys and they're always getting on each other's nerves. And my older one always says to the younger 2, if he's annoying them, they're like, "You're so annoying." And he'll say, "You're choosing to be annoyed." And the funny
oh my gosh.
The funny thing, which you can't argue with, right? So he always he which then makes them more annoyed. But I think that some of this, and I'll be the first to admit this, we are choosing to feel miserable. That's part of it. Yeah. But you can fix it. You talk about cooking and you talk about diet and how foods can change your serotonin levels and affect your hormones. Phytoestrogens but you got to know what to do, and you got to know what your imbalances are. And so eventually on my website that I mentioned, for women, that the ultimate test would be to have this done with either blood or urine, because that gives us a direct answer. But if you can't afford it or you don't want to go to the doctor, I'm going to have a quiz. There's going to be about 30 questions or so that's going to help figure out just through symptoms what archetype you might be in.
Awesome. And I will definitely put that in the show notes for them to click through. I really appreciate all the information. I am super excited about your book. I think it's just going to be so valuable.
Thanks.
And then are you on anything else? I know you mentioned your website and Facebook. Is that all? What about Instagram or Twitter?
I have a Twitter. It's at Tassone, TASSONEDOC. Okay. And I'm new to Instagram. And honestly, I went to Instagram because my 12-year-old was on Instagram, so I'm spying on him. But I've been finding out that Instagram is pretty big nowadays. So I have my handle, or whatever you call it, on Instagram is Hormone Guru.
Awesome. I'll have to find you on there. Yeah, Instagram is the greatest, and it's a really easy platform to be found on versus Facebook's a little bit harder. But yeah, that's great. Thank you so much for coming on the podcast.
You're welcome. Appreciate it.
Bye everybody in the podcast.
The contents of this podcast are for educational purposes only. This information is not intended to replace a one-on-one relationship with a qualified healthcare professional, and it is not intended for medical advice. This is the sharing of knowledge and information from education, research, and experience. I am not a registered dietitian or physician. I encourage you to make your own healthcare decisions based on your research and partnership with a healthcare professional. Thanks for tuning in. I'll see you next week.